I'm Ezrah Raya, and this is the Manila Times. 115 million Filipinos. That will be the population of the Philippines by year's end, according to the projection of the Commission on Population and Development. The Philippines is now the 13th among the most populous countries in the world and 7th in the Asia-Pacific region. CPD, formerly known as PopCom, claims that the birth rate in the country has stabilized or slowed down, which could open up more opportunities for growth. President Bongbong Marcos had just signed the Philippine Population and Development Plan of Action for 2023 to 2028 through Memorandum Circular Number 40. The Plan of Action is designed to address population challenges and attain socio-economic development through comprehensive programs. Here to tell us more is Commission on Population and Development CPD Deputy Executive Director Lolito Tacardon. Welcome to the Manila Times, sir.
Thank you, Ms. Ezra, and sa lahat ng mga taga-subaybay ng iyong program.
Sir, based on your projections, the Philippines population will reach 115 million na po, by this year's end. So on CPD's analysis, are we overpopulated?
Actually, our estimate was just very roughly based on the population growth rate from 2015 to 2020, which is at 1.6%. That's around 1.6 million Filipinos being added to our population. And the official estimate actually will still be released by the Philippine Statistical Authority. But that's soon already. Mga around before this year ends, we already have the official estimate and projection of the population based on the 2020 population census. But based on the 1.6%, mga roughly around 115 million by the end of this year. In our current perspective now, particularly in terms of the policy direction for the population management in the country, we're not looking anymore actually doon sa numbers, no? And the discourse in terms of overpopulation has been shifted to actually quality of the population and the human resource, because as per latest data rin, nakita natin that based on 2022 National Demographic and Health Survey, the fertility of women in the country continues to decline. No? Actually, we've reached the replacement fertility level, which is 1.9 children na. Our replacement fertility level is actually at 2.1. So mas mababa na yung actual fertility natin than the replacement fertility. At the household and individual level, we consider this as an accomplishment because somehow tumutugma na siya doon sa tinatawag natin desired fertility level of Filipino women. No? Pag tinanong mo kasi yung mga kababaihan and ask them about their desired or if they have a way to choose kung ilan lang yung kanilang anak, they would prefer 2 children. So actually, dalawa na. So ibig sabihin, the wanted and actual fertility is more or less close na siya. No? So it's an indication of a greater capacity of women to achieve their desired fertility intentions na. So given this, nakikita natin that we already have an opportunity to improve and to contribute to the improvement of the quality of life of families, having that capacity to plan in terms of the number of children, because basically we've been saying that if couples, individuals would be able to achieve their desired fertility, they would have better capacity to invest on the health, education, and they can be participative in the labor force or employment. So kumbaga parang from human numbers, we are now focusing on human lives sa ating programa. That's why the issue of overpopulation in the country is not anymore that significant when it comes to public discourse.
Based on what you said, sir, so the Philippines is now moving away from being an overpopulated country, although we did rank 13th in the most populated country in the world. But like what you said, the birth rate has stabilized. And and from what you said as well, sir, it's the quality of life. It's an opportunity for the quality of life to get better and better for the Filipino. So based on this population growth projection, sir, do we know how much percentage are born from low-income families?
Yeah, basically nasa 18% pa rin yung ating poverty threshold kasi. So that means the proportion of population below the poverty threshold is at that level. And as you mentioned, I think one of the areas which the population and development program in the country is focusing on is actually in terms of capacitating women belonging doon sa mga poor and those who have lower education, because the data that I mentioned, the 2022 National Demographic and Health Survey, if you quantify that and disaggregate that by quintile, economic quintile, mataas pa rin yung fertility level of women who belong to the lowest quintile, no, yung poorest of the poor, no, mga nasa around 3 children pa din. And there's still one gap, one child gap, in terms of desired as well as compared to the actual, no. So that's why part of the strategy of the government now is of particularly for the population and development strategy is to be more targeted in terms of the beneficiaries that we are to reach, no. So there should be preferential treatment, of course, among the poor, because the poor, actually the poor, no, all the factors contributing to higher fertility converge among the poor.
On this note, sir, what are the projects of the CPD or PopCom for population development in the coming year 2024?
Thank you for that question, because it's an opportunity also to inform you that the president actually just signed the Memorandum Circular number 40, which approved the Philippine Population and Development Plan of Action for 2023 to 2028. And that's basically the blueprint of our country when it comes to ensuring that our population outcomes and conditions supports the socioeconomic development agenda of the government. So one of the key strategies under the plan of action is still another continuing promotion of responsible parenthood and family planning. But as I mentioned, it will be more focused on those groups or segment of population who are still incapable of achieving their desired fertility objectives. Secondly, we continue to exert and pursue initiatives that would reduce further adolescent pregnancies and through adolescent health and development, because as you might have been informed, no, the condition of teenage pregnancy is getting worse because mas bumabata, no, yung proportion of those who are getting pregnant among adolescents. So yung proportion of live births among 10 to 14 ay tumataas, no. So that means that's more alarming, than the previous concern, dahil it has a huge implication when it comes to their health. Another is in general, we'd like to influence different sectors like health, education, employment, to consciously consider population factors in those programs, because basically it has demographic situation has direct implication in the sectoral development. Like, for example, the increasing proportion of working age population is a critical consideration in ensuring that Filipinos are employed and in pursuing economic development. So actually, that's one demographic opportunity that we have right now, because we have an increasing working age population, which if the country can successfully take advantage of through increased employment, then there's a potential that we can accelerate socioeconomic development in the country. But of course, failure to do so would result to dependence on government's resources, especially if employment would not be improved. We are also looking at interventions in addressing the issue, the emerging concern of older population, because right now, we have observed also an increasing proportion of population, especially those 65 and above. And even the senior citizens, 60 and above, are increasing now. Actually, it's senior citizens consists of 8.5% of our total population already since 2020. So this early, we have to look at the implication of an increasing older population in the country by understanding what should be the proper policies to ensure their welfare and to ensure that they still contribute to socioeconomic development. And lastly, of course, we'd like to ensure that our regional and local development plans take into consideration the population dimensions, because basically the provision of family planning, for example, and other population and development services are devolved functions. So that means local government units should be at the forefront of ensuring that they are able to address the needs of their population.
Thank you so much for that, Sir Lolito Tacardon. Like what you said, there's a lot of opportunity with the current population growth trend. So a lot of opportunity for socio-economic development. Maraming salamat po, Commission on Population and Development, Deputy Executive Director Lolito Tacardon. Thank you so much for your time.
Thank you very much for the opportunity.